Hey, what's good, y'all? So, I had a conversation earlier this evening with two people in Iran, and they were talking about I already talked about the way the IRGC was treating the medical professionals trying to help protesters and things of that nature during the riots, but they're continuing intimidation and other horrible acts against the medical community in Iran trying to help. And last night, or earlier tonight, I mentioned the Dr. Ameneh Soleimani. Apparently, she was a beloved, like a dermatologist with incredible bedside manner and type of doctor, physician with a genuine sense of caring. But during the protest, she quietly and courageously helped injured protesters, and she stayed true to her medical oath. But then, I guess they said they think a week ago she was taken from her home by the IRGC, and since then there's been no news, no contact, and no information about her whereabouts. And there's several other doctors in Iran with very similar stories. And there's several doctors in the US that are Iranian that have shared similar stories with friends and colleagues in Iran. There's other reports that indicate a growing crackdown on medical professionals in Iran, doctors and healthcare workers and like emergency service medical people. They were arrested for treating the wounded protesters. Just to name a few, Dr. Alireza Rezai, who was a urologist in Tehran, Martin Moradian, he was a healthcare worker in Mashhad, Dr. Saber Behajan, a neurosurgeon, also from Tehran, Dr. Farhad Nahadali, who's a general surgeon in Gorgon, and like I just mentioned, Dr. Ameneh, who was mentioned last night. But they were detained not for violence, but for providing care, and reportedly, and more possibly the most terrifying because they were documenting injuries, which to me sounds like an attempt to intimidate medical staff and control the narrative. But medical neutrality is a core ethical duty in a medical community worldwide. Treating the wounded should never be a crime. It's just scary, and I wish there was more I could do, obviously. But I'll say it again, or I'll put it out again. If you or anyone you know has contacts of people in Iran that have the capability and would be willing to speak with me, please let me know. I'll be good.